Do you ever struggle with forgetfulness, brain fog, or difficulty concentrating? If so, your memory issues might not just be a sign of aging or stress, they could be due to a vitamin B12 deficiency. This essential vitamin is crucial for brain function, and low levels can seriously affect your memory and cognitive performance. The good news is, B12 deficiency is easy to diagnose and treat. In today's video, I'll explain how vitamin B12 impacts your brain, who's at risk, and how you can boost your levels to improve memory and focus. What is the link between B12 and memory? Vitamin B12 is essential for protecting nerve cells and preventing damage, and supporting neurotransmitter function, which helps with focus and recall. Vitamin B12 also producing red blood cells, ensuring your brain gets enough oxygen. When you don't have enough B12, your brain struggles to function properly, leading to memory problems, confusion, brain fog, and even mood changes like depression or irritability. If left untreated for too long, B12 deficiency can cause permanent nerve damage, so it's important to act fast. Who's at risk for B12 deficiency? Some people are more prone to B12 deficiency, including older adults. B12 absorption decreases with age. Vegetarians and vegans, B12 is mainly found in animal products. People with digestive disorders, conditions like Crohn's, celiac disease, or gastritis can affect absorption. Those taking certain medications, long-term use of antacids or metformin, can lower B12 levels. If you're in one of these groups and experiencing memory issues, it's a good idea to check your B12 levels with a simple blood test. How to take vitamin B12 and the right dosage. Once you confirm a B12 deficiency, the next step is getting your levels back to normal. Here's how. Supplements. If your levels are low but not severely deficient, a daily oral B12 supplement, 1000 microgram per day, can help. Injections. If you have severe deficiency or absorption issues, your doctor may recommend vitamin B12 injections, 1000 microgram weekly or monthly, depending on your levels. Injections work faster and ensure your body gets enough B12 by bypassing absorption problems. Food sources. If you're not deficient but want to maintain good levels, you can eat vitamin B12 rich foods like meat, beef, chicken, liver. Fish and seafood, salmon, tuna, clams. Eggs and dairy like milk, cheese, yogurt. If you've been dealing with memory problems, don't ignore the signs. Low B12 could be affecting your brain, but the solution is simple: check your levels, start supplementing, and fuel your brain with the nutrients it needs. If you found this video helpful, hit the like button, subscribe for more health tips, and share this with someone who might need it. See you in the next one.